Hello and welcome to Henry Ford Health Center for Weight Management information session. My name is Helen Burr and I'm one of the health educators at Henry Ford. We are a team of weight loss and wellness professionals who are truly passionate about the work that we do, and we show a great deal of compassion towards our patients. Everyone that we've treated over the years started their process just like you're starting yours today. As we continue, I want you to be thinking about what your very important personal reasons are for wanting to lose this weight once and for all, and imagine how that's going to impact the quality of your life. I have one ask, and that is for you to view this entire session so that you can make the most informed decision on how you want to begin your wellness journey. Okay, let's get started. At Henry Ford Health, we offer a full spectrum of weight loss and wellness treatment options throughout our system. So why choose Henry Ford Health? We are truly a team of experts who have been working in this field for decades. Our multidisciplinary teams consist of doctors, nurses, registered dietitians, health educators, and exercise physiologists. We take a comprehensive approach to weight loss, and we focus on the big picture of your total health and wellness. The positive lifestyle changes that you'll make will allow you the potential to greatly improve the quality of your life. As you begin your weight loss and wellness journey, we are with you every step of the way to support and guide you. You will receive the best quality of care from us. The topics that I will cover during the session are weight management, benefits of weight loss, our program philosophy, program options, commitments, other available services, and of course, next steps on getting started. We are very clear that losing weight and keeping it off isn't easy, especially given the culture that we live in today. Managing your weight and health requires a lifelong commitment to developing and practicing skills necessary for you to significantly impact the quality of your life. In fact, extra weight may contribute to health problems over time. Some of the main risks of being overweight are developing diabetes, high blood pressure, heart disease and stroke, osteoarthritis, cancer, developing poor sleep habits, and high cholesterol. The good news? You can improve your health and feel better with a sustained weight loss of just 5 to 10% or greater. For example, if a 300-pound person lost 15 to 30 pounds and kept it off, they could experience improved health. There are numerous benefits associated with weight loss. Listed here are just some of the benefits you can look forward to experiencing. For example, lowering your chance of heart disease, cancer, or stroke, may decrease some medications, sleeping better, having more energy, moving easier, being able to do more activities with loved ones, having your clothes fit better, and improved mood. Our program philosophy is what we refer to as our 5-pillar approach. We want to make sure that you have a strong, solid foundation in the following areas: nutrition, physical activity, mind matters, environment, and accountability. As part of your support and accountability, you will be attending weekly 1-hour group sessions, either in person or virtually. These sessions have a variety of topics which are associated with each of our pillars. Not only will you learn a great deal about each topic, but you will set goals and make plans on how to utilize what you've learned and put it into action each week. You will learn about foods that are nutrient dense that fuel your body properly. Whether you're losing weight or managing your weight loss, you should never be hungry. In fact, we will teach you how to eat just as much volume of food as you are now for far fewer calories, allowing you to lose weight, keep it off, and stay full and satisfied throughout. Our teams will work very closely with you to learn, build, and develop weight loss and wellness skills. We want you to experience fast, effective weight loss from the beginning. And the best way to do that is for you to stick to the program 100% or as close to 100% as possible. As you continue your weight loss journey, making lifestyle changes, you will also be working on your wellness. Once you are at or close to your goal weight, we will continue to support you by keeping connected. Over the next several slides, I will be describing for you our program options. This will include seeing examples of what a day on the diet will look like for each of our weight loss offerings. As you listen and view the descriptions of each, I want you to be thinking about which diet option sounds like the best fit for you in starting your weight loss journey. Also, keep in mind that you don't have to start with one, and all options lead to our long-term weight and health maintenance plan. Choose the one that's going to set you up for success. Option 1 is what we refer to as our fast start plan. Although all plans provide structure, this option provides the most structure and offers the greatest weight loss in the shortest period of time. You will start with all meal replacements, then gradually add vegetables. The meal replacements consist of shakes, some which you can make into pudding, prepackaged entrees, soup, cereal, and nutrition bars. Options 2 and 3 are part of our working on wellness phase. Option 2 is a combination of both meal replacements, vegetables and fruits, and possibly other grocery store foods. This allows for both structure with a bit more flexibility. Option 3 is focused on our grocery store food meal plans. Meal replacements are optional, but not required in option 3. As you look at our fast start and working on wellness plans, you will see that there are far more similarities than there are differences. All program options include weekly meetings or classes, which you can attend in person or virtually, and check-ins with your health educator. You can touch base either by phone or email. Individual visits will be scheduled as needed. The duration for Fast Start is oftentimes 12 weeks, but it could be longer or shorter depending on how much weight you need to lose or when you're ready to add grocery foods into your plan. Medical supervision is required, so you would begin by seeing one of our providers. While in the Fast Start phase, you'll have weekly medical visits either before or after class. Working on wellness is a minimum of 6 months or longer, which typically has no medical supervision. So your first visit will be with one of our registered dietitians. Provider visits, labs, RD appointments are all billable benefits. In some cases, so are weekly classes. Like any other doctor's office, copays, deductibles, and coinsurance applies. Now let's take a look at some examples of our diet options. With our Fast Start option, let me just highlight a few important parts. First of all, notice that you'll be consuming your meal replacement foods at least 6 times throughout the day. You will see the same setup with the other examples as well. Spreading out your meals throughout the day will allow you to stay ahead of the hunger and provide your body with steady nutrient flow. The minimum total calories each day for this plan is around 700 to 800. However, we encourage you to utilize additional meal replacements because we never want you to feel hungry. You will decide with your health educator when it's time to start incorporating vegetables into your plan. Another important point I'll make is that within the structure and the limits of this diet plan, again, the shakes, pudding, cereals, soups, entrees, and nutrient bars, there are countless recipes to create more than 100 different flavors of meal options. When you begin to add vegetables, you add even more variety. Next up, we have an example of a typical day on the diet for option 2. We are once again spreading out your meals and snacks throughout the day because keeping you full and satisfied is an important strategy for both weight loss and weight maintenance. The combination of meal replacements, vegetables and fruits, and other healthy foods allows you structure with flexibility. The numerous recipes that we will share with you allow for countless different flavors and meal types. Finally, here's an example of option 3, which focuses on creating healthy meals using grocery store food. Meals that are rich with vegetables and fruits, lean protein, whole grains, low-fat dairy or dairy substitutes, and healthy fats. Let's step through the program costs. There is a one-time induction fee of $50 to begin. Next, our service fee covers weekly classes, connecting with your health educator by phone or email, and all of the materials you will receive. You have the option to pay $450 upfront for 6 months, or you can choose to pay $75 per month. We will waive your induction fee if you choose to pay upfront. The weight loss option you choose will determine where you will spend your weekly food bill. For Fast Start, you will purchase your meal replacements, which are foods, from us. The daily cost ranges from $12 to $15. For our Working on Wellness program, daily meal replacements range from $12 down to $7 per day. So you will spend part of your food allowance with us and part at the grocery store. However, if your plan is focused just on grocery store foods, well, that's exactly where you will spend the majority of your food allowance. In terms of meal replacements, this is not an additional cost, but a cost in place of grocery store and restaurant foods. If you've been out to lunch recently, you'll know that one meal can easily cost between $12 to $15, not including the tip. Which program option will work best for you? Once again, option 1 offers a faster weight loss. So if you have a lot of weight you want to lose, or you like the idea of making fewer decisions about what to eat, you may want to start with 1. If you like the idea of using some meal replacements for added structure, but want more flexibility with your plan, then option 2 is a great place for you to start. Finally, if you want a plan that focuses primarily on healthy grocery store foods, then option 3 is your best choice. All of our previous plans mentioned lead to our long-term plan called Keep Connected. Many would agree that this is the most important part of our program. Here is where you will learn to manage your lower, healthier body weight during holidays, vacations, social events and celebrations, life changes in general. Here is where you will be practicing your developed lifestyle skills at a very high level. We provide a nice reduced rate for you when you're on the Keep Connected plan. You will either pay $250 upfront for an entire year or $24 per month. Class fees may be a billable benefit for some insurances. Now let's review our program commitments. As I stated earlier, losing weight and keeping it off isn't easy. In fact, we view it as a complex skill. And if you think of other complex skills like learning to speak a foreign language or learning how to play the piano, it takes commitment, practice, hard work, and time to reach proficiency. We ask you to commit to a minimum of 6 months. However, many of our most successful patients stay with us longer. When it comes to health benefits, physical activity is one of the most important things to incorporate. We will work with you to develop a physical activity routine that's absolutely attainable. Next, making your health and wellness a priority is absolutely essential. So we have you attend weekly classes either in person or virtually. Attendance is the #1 predictor of success, and the bottom line is that we want you to be successful. Additionally, we ask that you track some of these new healthy behaviors that you'll be practicing on a daily basis. We have an app to assist you, or you can choose another tracking method. Finally, accountability lives within each of these commitments, supporting you to follow through with each piece of the program. Our conditions of treatment were designed with one thing in mind, and that is your success. Attendance is the #1 predictor of success. Please notify us in advance if you have a conflict, so we may reschedule you or cancel. Let us know upfront if you have any food allergies or intolerances. Make sure to read the ingredients displayed on our food labels. You are responsible for any charges not paid from your insurance company. If you have questions, please contact your insurance directly. You must follow your prescribed meal replacement plan for both safety and success. If you're having difficulties, please let us know. We do not provide refunds for early termination or for purchased products. However, unopened products may be exchanged or returned for credit. Finally, payment is due at the time of your first appointment. Please feel free to pause the presentation at this time so that you can thoroughly read through the conditions. Because there is not just one way to safely lose weight, Henry Ford offers additional services such as bariatric surgery, obesity medicine, nutrition consultations. We have exercise programs, we make referrals to behavioral health, and we can perform assessments of resting metabolic rate and body composition. We may need a referral from your provider. It will depend on your health history or your health insurance. Rest assured, we will work closely with him or her in managing any of your health concerns. Medical management is offered through certain plan options or obesity medicine. Remember, you will never be alone during your weight loss and wellness journey. We will be with you every step of the way. Once you complete viewing this presentation, please choose a plan and location. You can reply to us through MyChart, or you can give us a call. Our team will verify your insurance. Please allow 7 to 10 days to get started in the process. Sign up for Veritastic app and complete any MyChart questionnaires once you make your appointment. As we near the end, I want to share with you a patient testimonial. Mark is one of our many successful patients who has lost and is keeping off over 100 pounds. He started the process just like you're starting yours now. He was feeling a cocktail of emotions ranging from hopeful and excited to anxious and nervous. He didn't want his body to limit him from doing the things that he wanted to do. Why do you want to lose weight? I'm asking you to consider allowing us to help you improve the quality of your life. No one's weight loss journey is perfect, but it's absolutely possible. On behalf of all of my colleagues, I'd like to thank you for viewing our information session and for choosing Henry Ford Health. We look forward to hearing from you in the near future.